All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So there has been the news of 2DG, a drug that has been approved in India on 1st May. And many cool beans have been asking that we should talk about it. So this morning we talked about the black fungus. I think I'll talk about that separately as well tomorrow. And now I'm going to talk about the drug that is approved and how does it work. So let's start our discussion. Hope everybody is doing good. And I'm going to start off this session with another art piece that I made. I did this over this weekend as well. The name is Lockdown. The point is that we are all sitting at home and our boards and yards and everything is just sitting out there. So this is Lockdown. And now let's start our discussion. So the discussion is, let me show you the links first. The links are, this is the Ministry of Defense, and from there, this is the discussion or the approval message. So I have taken a lots of notes from this message. Then what is the 2-deoxy D-glucose? That is a link over here, and that's what I'm going to explain today as well. Then what is normal D-glucose? That is over here as well. We all know a lot. In summary, what we are going to talk about is the following. Remember, we have been talking with the antivirals, that what some of these antivirals, what they do is they mimic, they behave as fake material, building material for the virus. They mimic as fake material. And when the virus enzymes use those material to make new viruses, those new viruses are disabled and damaged and they cannot function. Similarly, over here, this drug is going to act like a fake glucose. So as the cells are going to pick up that glucose and accidentally pick up that drug and try to use it as glucose, it is not going to work like glucose and not help the cells make energy. And the result will be that cells would not be able to get energy. Now, those cells that have infection in them, for example, with SARS-CoV-2, these cells are actively working because inside them all machinery is running by the virus and the virus is making more daughters. And now these cells would need a lot of energy. So if you give fake glucose, then those cells that are active, these cells will not be able to function properly. And the viruses inside the cell cannot make more viruses because everything needs money, and that money is energy inside the cells. And so the viruses cannot be formed. That is a basic summary of this. Now let's see how does this whole thing works. So the Drug Controller General of India, DCGI, approves 2-DG drugs, so 2-deoxy D-glucose, and I'll explain what that is. The summary of the drug is the following. It is developed by Institute of Nuclear Medicine and Allied Sciences, INMAS, which is a lab of Defense Research and Development Organization, or DRDO. The EUA, or Emergency Use Authorization, was given on 1st May, and it is given for moderate to severe patients. It is given for moderate to severe patients who are on oxygen, and it helps them. The drug is observed to help accelerate the clinical recovery fast and reduce the oxygen dependence fast. Interestingly, why this is an important drug, the formulation is really sachet packs. So it is powder. It is in powder form, present in sachet packs, and you can give them to hospitals, and this is taken orally. And why this is interesting is, number one, the symptomatic recovery improved with this drug. There was a 2.5 days difference in acceleration of oxygen independence. So for example, if somebody is on oxygen and they would stay on oxygen, let's say for 7 days and then recover, if they were taking this drug, they would be, the oxygen dependence would reduce within 2.5 days earlier. Then reduction of clinical symptoms is there, reduction on the oxygen need is there. And then here is what is very interesting. In one of their trials, what they found was that the oxygen dependence was reduced by day 3 of using this drug. And 42% reduction was observed in the group that was taking the medicine, and 31% reduction was observed in placebo. So there is a significant improvement. Another important thing is that this is easily available because it is really a glucose. It is a modification of glucose. So it is a modification of sugar. So it is an easily manufacturable drug. It is easily available drug. It can be shipped easily to various parts. Plus it is inexpensive as well. So because of those, this is a good drug. Now, what is 2DG? What is this drug? So summary is done. So if you just wanted to hear the summary, we are done with that. Now, what is this drug itself? So look, here is a normal regular sugar glucose molecule. It has 6 carbons on it. Because of that, we call them hexoses. There is this carbon as well. So it is a 6 carbon sugar, the normal regular sugar that we eat. It is called dextrose or D-glucose, so dextroglucose. It is a regular sugar. It is a monosaccharide. It is called a hexose. So please keep this in mind, hexose. Hexose meaning 6, because we'll use this a little later. And here is the drug. The drug is actually in the 2nd carbon place. And again, if you have not done organic biochemistry, it doesn't matter. The carbons are lined up in a chain. So carbon, 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 and so on. So we count them 1, 2, 3, 4. So in the 2nd carbon place in the glucose molecule, here the hydroxyl group, the OH group. So see here in the glucose side, there is an OH group here. This OH group is actually not here. Instead, it is just hydrogen. This is why it is called deoxy. Deoxy means 1 oxygen is removed. So this is actually dextro or dextroglucose, but at the carbon number 2, 1 oxygen is removed. That is a total modification. So now it is 2-deoxy dextroglucose, and now it is actually, our body is going to think this is glucose, pick it up like glucose, but our body is not going to be able to use it to make energy like it does from the normal glucose. So it is fake material. So for our cells, it is fake news. So here, now let's go in a little more depth. So imagine, how does this whole thing work? How does glucose work? So here is a cell, and we have done this discussion when we did the diabetes session. Cells need glucose to make ATP. ATP is the energy or the currency of function inside a cell. Any enzyme that is going to do anything, it is going to say, before I do something, give me money, and that money is a phosphate from ATP. So whoever has more ATP is richer. So people who are actually able to eat more or eat sufficiently or healthy, their cells are rich as well. So these cells have channels on them, which are called glut channels or glucose transporters. These glut channels are of many type, I think about 14 types. 4 of them are more important. The glut transporters, they take up glucose molecule and they transport that inside the cell. That is their function. Some of the glut transporters or glucose transporters, they need insulin to operate. So insulin's presence is necessary for the transporter to work to bring glucose inside the cell. There are other glucose transporters that do not need insulin. For example, in the beta cells of the islets of Langerhans in pancreas, these are the cells that make insulin. Their glut transporters or glucose transporters are open transporters. They do not need insulin to work. But anyways, just keep this much in mind, that glucose enters our cell not freely, but through the channels. Now, what happens is, so in the previous diagram, you saw that the glucose was attached to the channel here. Once the glucose attaches to the channel, and if the insulin is needed, it is present, then the channel flips and brings the glucose inside. So actually, channel has a conformational change. A conformational change in medicine means a change in the shape and structure of a protein. And so when the glucose binds to the protein, there are electromagnetic forces that change, and the bonds that change, and the shape of the protein changes, and then glucose falls through the channel inside the cell. So now the glucose is inside the cell. The next problem for the cell, now is it has gotten the money. It wants to now save this money, because this glucose can actually turn around and leave the cell. This is just like money. You can get the money and just spend it and it's gone. So the cell is now thinking that, man, I really need this glucose. I'm going to make energy from this. I don't want this glucose to get out of myself. So how does it trap the glucose inside? There is an enzyme called hexokinase. Hexo, once again, I requested you to keep the word hexose in your mind. So hexo means something that would work on six carbons. So that is the glucose. And kinase is an enzyme. Ase is for enzyme names, and kinase is something that would cause phosphorylation of some product. So let me simplify it. What that does is it activates some things. So here is an enzyme. What this enzyme is going to do is, when this glucose is present, it is going to attach a phosphate on it. It is so clever. Our cells are just weird. They are so clever. What they do is, and when I say weird, I say that in admiration of them, that, hey, man, you cell, you are weird. You are awesome. So what happens is, the glucose, we are afraid it's going to get out. So to stop it from getting out, imagine if you have someone who is your loved one and they come to visit you, and now you don't want them to leave. So what you do is you make them big enough or changed enough that they cannot move through the door anymore. So here is what we do. We take the glucose molecule and we attach a phosphate on it. So this becomes glucose 6-phosphate. So at the 6th carbon, we attach a phosphate to it. And who does that? The hexokinase. Yes, the medicos who are here, I know that in liver, we have other enzymes as well. But in the rest of the body, we have hexokinase. So we have glucokinases as well. Anyways, so now we have attached a phosphate with this. When the glucose has a phosphate attached with it, this glucose cannot fit into any other membrane proteins to get out. It has become structurally so different. Plus, it has gotten a phosphate on it, so it has become charged as well. So the cell membrane is not going to let this glucose come near it, because cell membrane does not like charged things. Hey, Luffy, how are you? So Luffy has approved the drawings today. So now this molecule cannot get out, and we have trapped it in. So now it is ours, the cells. Okay. So hexokinase is very, very important to trap the glucose inside a cell, correct? So please keep this in mind. Hexokinase is very important to keep the glucose inside the cell. And hexokinase's function is very important to attach a phosphate to the glucose. Otherwise, glucose cannot stay there. Okay. Now, the cell would make energy from that glucose. It would make ATP, adenosine triphosphate. It would make GTP as well, and it would just be happy. And there is a lot of battery there. There is a lot of energy there, and every function can be carried out. Very good. Now, how does this drug work on this? So check this out. On this side, there are hexokinases, and they are standing there, and they are all crying. Why are they crying? Because, see, their phosphates are also dropped. They just cannot function anymore. Why can they not function? Because this drug here, this glucose molecule that came in, the loved one that came in the door, we want it to be here. It has a different configuration. Instead of a hydroxyl group at the second carbon, it has a hydrogen at the second carbon. So the shape is different. And when enzymes work with some substrate is something that they work on. When enzymes work on something, they kind of bind with that thing. And then they work on it. They kind of hold it and then work on it. Now, hexokinases cannot hold this molecule anymore because the shape of the molecule is changed. Just because of one oxygen missing there, the shape is now changed, and hexokinase cannot work on it. So when hexokinase cannot work on it, imagine this. Outside, there is a competition. There is a glucose here, normal, regular, good glucose. And here is this drug that is going to also look like glucose. This drug is going to competitively inhibit the entry of the glucose in the cell. Why? Because this drug is present there as well, and it's going to tell the transporter that, hey, take me, pick me, take me inside the cell. And the transporter doesn't know better, so it's going to just pick up this drug and bring it in. This is called competitive inhibition. It is concentration based. That means the more the drug is there, the more it would compete with glucose. If you increase the glucose levels, then that would compete with the drug. So here is the drug. It would enter the cell. Inside the cell now, cell thought it brought in glucose. But hexokinases try to plant a phosphate on it, and they cannot. So if the phosphate cannot be attached to the glucose, glucose cannot pass through the next steps of glycolysis or the steps of making energy. So this whole thing is stalled here. Done. We brought in some money, and that was fake money. We cannot use it anymore. So now the cell cannot convert this glucose into ATP. Now the cell does not have sufficient energy. There are some energy stores that are already present, but they would be for a few minutes to hours. And after that, there are not much. There would be some glucose that is still coming in as well. So cell is now working at a very basal low level. The lights are off. The cell is just not able to do the function correctly. And so what would happen is, so as you can see here, the cell is really sad now because all of the things it wanted to do are not done. And if you see here, this distressed and frustrated SARS-CoV-2, that is standing there and is also upset. Why? Because all the enzymes in the cell, this enzyme ribosome is not working correctly. It doesn't have enough energy, so it cannot make more viruses easily. Then you can see here the debris of the viruses. So there are dead viruses, that half-built viruses, which are waiting for more manufacturing, and there is just not enough energy for the manufacturing. So this cell has become a poor cell. Here is another enzyme that is just dead because it doesn't have energy. So the result is that more SARS-CoV-2 are not produced fast enough. And that would allow, so immune system would now catch up, correct? So that would allow the immune system, number one, immune system would relax. So it would not go mad. It would not go towards these severe cytokine storms. Secondly, it would have a chance to catch up with the viruses because and the infection because there are less viruses. There is less damage as well because less viruses coming out, less viruses are destroying cells and so on. So we introduced fake glucose. Now, a quick timeline of this one, and I'll talk a little bit more about the drug after this one. This is in the context of COVID. I'll talk about what other things we've been using this drug for. So the timeline for this drug's usage for COVID is the following. In April 2020, last year, the lab testing for this was started. And they found that in vitro studies, that is inside the lab, outside of the body, in vitro studies showed that this drug was able to stop cell virus growth. This is similar like ivermectin that we found, the Cali study that they found in vitro that the drug was, ivermectin was able to stop the replication of SARS-CoV-2. It's a very similar thing. They saw that it would, the 2DG would do the same. In May 2020, they were given the permission to start the phase 2 trial. So from May 2020 to October 2020, we're still talking last year, they conducted the phase 2 trial. There were 110 patients, and they were patients with the safety and patient with the dose. So multiple hospitals were involved, multiple states were involved. And so safety and recovery was observed. And they saw that drug was safe. And secondly, it was improving clinical recovery of the patients. In October 2020, they presented those findings to the authorities once again. And in November 2020, they were given permission to start phase 3. December 2020 to March 2021, phase 3 was started. In this phase 3, there were 220 people, And if you see here, the folks who are from India and Pakistan, they could probably see I made these fancy schmancy little shoes with those curly tips. We call them kusa in that language. So December 2020 to March 2021, there were 220 people who took part in the phase 3 trial. And so then on May 1st, 2021, this month's beginning, an EUA was granted to be used. And then today we are sitting here talking about this drug. That is the basic idea of the drug. So what is really the drug doing? What this drug is doing is that it is bringing in fake glucose. Cell can pick it up. So cell thinks that I have gotten the money. It does not pick more glucose now. But the glucose that it has taken up, that glucose will not work successfully with hexokinases. And as a result, the cell will not be able to make ATP. The cell's energy is lost. Viruses will not be built. Cells' functions will not occur successfully. And the viruses would start dying. And the cells even would start dying if you give it an extra dose. And that would be the side effects. This drug has been used previously for a few things. Number one, in people where we want to understand there are two kinds of usage here. If you want to understand what kind of tissue is working more than others. So for example, you give some drug to an animal, and then you want to see, is brain working more now, or the heart working more now, or liver? So you have given a drug to do something. Then you can introduce this glucose, 2-deoxy D-glucose, and you can tag it with radioactive material. So it has fluorescence. And when those cells that are more active will pick up this glucose, now you can take pictures of what areas are fluorescent, and you can say, okay, this tissue is working more. So that was one usage in the labs. There is another usage that at one point, it is thought that tumors, because tumor cells are also unregulated cells, and they're just doing whatever they want. They just keep dividing and keep increasing in number, and they keep having their activity. So it was thought that, hey, giving 2-deoxy D-glucose will be useful because tumor cells will pick it up because they're dividing and functioning more, and they would now get fake glucose and they would now start dying or would not work that fast. The trials so far, in this case, 60% of the patients continued to have their tumors grow without much effect. So this drug was not very much useful. And there are still more studies going on to figure out, can we add it as an adjunct and combine it with other drugs? So these are some other usage of these drugs as well. So this has been out there for some time, and here is a new use. And I remissed saying this, the authorization is not for it to be used alone, but as an adjunct drug with other standard of care drugs. So that is a discussion. Please do me a favor. Please like, subscribe, and share. And if you would like to support this work, if you like and enjoy this work, and you would like this work to continue for others as well later on, you can support this work. There are 3 links in the description to support it. One is if you would like to buy me a coffee. Buy me a coffee is really useful if you don't want to use PayPal. And then there is another link to become a patron. And then there is one more link to support this work in general. So with this, thank you very much. I will join you back in 5 minutes for a chit chat.